pro-life groups are putting the pressure on the Department of Health and Human Services to stop funding research using aborted baby organs and tissue purchased from the abortion industry. The pro-life Susan B. Anthony list is calling on HHS Secretary Alex Azar to put an immediate moratorium on research experimentation on fetal tissue. The HHS Department late Monday announced it canceled a nearly $16,000 contract with Advanced Bioscience Resources to reportedly fund efforts to implant human fetal tissue into mice to create a human-like immune system. But pro-life groups insist this cancellation is not enough because the National Institutes of Health funds fetal tissue experiments with nearly $100 million. HHS's cancellation with the fetal tissue firm follows a letter from 85 members of Congress calling on them to do so. Joining us now is Republican Congresswoman Vicky Hartzler of Missouri. She helped spearhead the congressional letter to the FDA objecting to the contract with the fetal tissue firm. Congresswoman, thank you for your time.
You bet.
First off, is the latest action from the Department of Health and Human Services enough, in your opinion?
I think it's a very encouraging first step. I was very pleased that they have canceled the contract with Advanced Biological Resources. This company has been buying and selling baby body parts for a profit. When I was part of the investigative panel on infant lives, we found them that they had been doing this, referred them to the Department of Justice for further investigation, and it is just unethical what they have been doing in violation, I believe, of federal law. So I was very pleased that they canceled that contract. Having said that, I now would like the Department of HHS to go further and to cancel all of the contracts of other companies that are being funded through the National Institutes of Health Research. That adds up to about $95 million a year. I was encouraged that the Secretary said that they were going to be examining each and every one of these contracts and seeing if they comply with federal law and seeing what can be done, that they were also going to explore alternative ways to perhaps come up with tissue that could be used in research that is ethical. But I will feel better when all of them are canceled.
Congresswoman, as you mentioned, you did serve on the House Select Investigative Panel on Infant Lives in 2016. That panel did issue a criminal referral of Advanced Bioscience Resources. Can you outline for us, what did you learn about ABR then that concerned you?
Sure. Well, they were buying baby body parts from Planned Parenthood, paying $60 per fetus, and then they were dividing up the baby and selling the individual parts for up to $325 per part. So they were selling a brain for $325, the lungs for $325, the eyeball for $325 to these research companies. It is just sickening, and it just has to stop.
That is disturbing. And even though this FDA contract is now canceled and you did call for that, why would the FDA issue this contract with a fetal tissue firm in the first place?
Well, they would have to answer that. I suspect that they didn't know about this, that this has been a pattern for a long time, that this research has been going on. We just found out about it in the last couple of years as members of Congress to shine the light on it. I think there probably was just somebody in the bureaucracy that just approved the past research and didn't really examine it perhaps as closely as they should have. That is my hope, that it was just a mistake, that it was an oversight, but I am pleased that they have taken decisive action now to cancel that contract, and I hope that they will take decisive action to cancel similar contracts that are using aborted baby body parts through the National Institutes of Health Research.
Absolutely. We'll keep our eye on that. Representative Vicky Hartzler of Missouri, thank you again for your time.
You're welcome.
For more reaction and analysis, we're joined by Marjorie Dannenfelser, president of the Susan B. Anthony list. Marjorie, thanks for being here.
Always glad to.
You called this latest action from the Department of HHS completely inadequate. Why?
Well, it gives me some pain to say it to you, Catherine. I mean, I consider a pro-life family now. We've been through meetings with Francis Collins, meeting with the Secretary of HHS, Deputy Secretary, White House, all around. And it's not okay just to cut off a contract with one bad offender. The whole policy of using baby body parts as a method of experimentation, as a method of therapy, which is just proved as effective, is just wrong, and it has to end. So what we've been hoping for, asking for, lobbying for, is a moratorium on all of that experimentation. And nothing could be more obvious to make the point than that David Daleidon's videos exposing the thing. One thing to say that they should abide by the law. Okay, they're abiding by the law. Nobody's breaking the law, but the law is a bad law. And there is no requirement in the law that says that you must use baby body parts in science. There just is none. So it has to stop.
And to be clear, federal law does prohibit the buying and selling of human fetal tissue for valuable consideration. But isn't that what's going on here?
Well, that's exactly the point. That's exactly the point. It does bar it. Now, I was on the Hill when this whole policy was being formed. It was passed into law, but it was passed into law by with a lead of pro-abortion Democrats in the House of Representatives who were very much for fetal tissue research. So basically they said, if you're going to do it, this is the way you're going to do it. Now that we have a pro-life, the most pro-life administration in history, we have a House, we have a Senate that is entirely pro-life, there is no reason that we should feel under any obligation whatsoever to do this type of research.
Marjorie, do the mothers of these aborted babies know that this research is going on?
It's a good question because it is part of the law that was passed to sort of manage and regulate all of this. And no, very often they don't. And we know that because some of the informed consent forms we can see. David Daleidon actually was able to, and other organizations, Abby Johnson has gotten a hold of some of those too. So we know that very often these women in very, vulnerable situations truly don't know what's going on, and they should certainly know at a minimum what's happening.
Well, we will continue, and I know you will be continuing to watch
we will.
what develops and what goes on here. Marjorie Dannenfelser, president of the Susan B. Anthony List, thank you.
Thank you.